Hey Neuro Rehab class, I'm here to talk to you today about my journey for getting my NCS. Sorry the technology didn't work out the other day when we were in class. So I started loving neuro back as a student. I graduated from UNLV in 2017, and I just immediately had such a fascination with neuro. I wanted to learn all about it. I went to all the CSM talks that were about neuro, and so I just sensed an early passion for it. I think there's a way you know your passion in PT, and it's when you study and spend time learning more about it, even when you don't have to. So I knew early on that I loved neuro, so just spent a lot of extra time researching and getting to know more. I worked as Dr. Lander's GA as a student, and so I got to help out with neuroanatomy. So then from there, when I graduated, I worked a full-time outpatient job at a clinic called Synergy, where I saw a really wide variety of patients, which is kind of what I wanted. I did focus towards neuro, so any neuro patients that came into the clinic did come to me, but I was maybe 50% of a neuro caseload, but definitely getting my feet wet in neuro. But then at the same time, got the opportunity to teach at UNLV neuroanatomy lab, and then ultimately I taught neuro rehab lab with Dr. Nash, which I miss greatly since moving back up, of course. So that's kind of when I was honing in more of my clinical skills in the neuro world, but then also staying involved in a lot of the education through teaching. So about a year and a half ago then, that's when I decided to move back up to Reno, where I took a full-time outpatient neuro job at a hospital. Compared to private practice, the hospital just gets a lot more neuro patients, and I just get a whole lot more time with them, which you really need when you're working with the neurological population. I took my NCS exam this spring, so I began studying for it a little over probably a year ago. So about the summer before it is when I really first started to kind of prepare for it. I decided not to go the residency route because once I graduated, I had gone pretty much straight through school and was just kind of ready to work and get my feet wet. So that's why I chose not to do a residency and just kind of study and do it on my own. But I began studying the summer before, just doing online Con Ed courses through MedBridge. But then formally every week I participated in what's called the Neuro Consortium, which is a lecture series with some of the top neuro educators and researchers in the country, giving kind of the updated research and evidence about all the different neuro conditions and diagnoses. So that was in collaboration with a lot of the other neuro residency students in the country. So that was an awesome kind of networking opportunity. And then that was for about 6 months every week on Tuesday evenings for about 2 hours. And then come the new year of the exam year, I started studying at least 2 nights a week after work, and then pretty much every Saturday and sometimes a little bit more, just on my own, reviewing some of the prep course stuff that I had done. So it was definitely intensive. It was at least 8 months probably of studying and prep beforehand, but I learned and figured out midway through studying that the ultimate benefit was really just how much extra time I was spending learning this material and how much more time I was reading the updated literature. I was in the kind of newest know about everything that there is, and so for me it became the benefit was the studying for it, not even the end result of the exam. So it was a nice mind shift switch once I was able to just realize that the benefit comes from the preparation. Whatever the result of the exam is, my patients are benefiting more because I'm up to date on my research, I'm up to date on the literature. So that was the mindset I tried to go in with, and I took it in March of this year. They wait a painfully long time to tell you your results, but I did find out that I passed, which was a huge reward for all the studying that I had put in. But the exam is very case-based. It's very much based on the updated evidence and literature. It's very much about clinical decisions and what the research points us to as outcome measures, as treatment options, as referral out for patients when needed. So I would really strongly recommend to anyone considering a specialty to do it. I think that in school, you get such a great foundation. You get a really great starting point for so many areas of PT, but wherever your passion lies, I would really encourage you to pursue a specialty in it, because my confidence as a clinician went up unbelievably after passing my exam, and my, just ability to market myself to doctors, to say, hey, listen, this is why you should send your patients to me. I've spent this time studying and prepping, and can truly provide hopefully the absolute best of care. I think specialty allows our profession to move forward in such great ways, and in ways that it needs to. So other than that, opportunities that I hope to get out of having my NCS is maybe future teaching opportunities. I'd love to teach again if we get a school up here up north. I'd love to teach again. I think that it's going to hopefully open up some doors there, but then also just education amongst my peers and my colleagues here is really opened up, and like I said, also opened up a lot of windows for me to speak with physicians with better confidence, and just make those clinical decisions that ultimately are providing the best outcomes to my patients. I've seen a huge difference in my practice since studying for it, and I ultimately feel like my patients are really gaining the benefit. So please email questions if you have them. Other than that, keep following your passions, find what makes you excited and makes you want to learn more, and good luck with the rest of the semester.